Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Eye drops for pink eye. Eye drops for pink eye include both over-the-counter, OTC, and prescription medication. Prescriptions may be antiviral or antibiotic eye drops, depending on the underlying cause. /r/n/r/n pink eye, otherwise called conjunctivitis, is a common condition. Conjunctivitis involves inflammation of the conjunctiva, the membrane that covers the white portion of the eye. The conjunctiva provides lubrication to the eye's surface. It also has many blood vessels that can become inflamed, giving the eye its distinct pink or red color. /r/n/r/n The body can fight off pink on its own. However, a healthcare provider can determine whether you might have a treatable form of pink eye. /r/n/r/nturkstockphotographer, Getty Imagesrnrn There are 3 different types of pink eye and they each require a different treatment approach. /r/n/r/n Visiting a healthcare provider is the only way to know for sure which type you have. A healthcare provider may be able to tell based on your history and symptoms and by conducting eye exams. /r/n/r/n Even then it can be difficult to distinguish between these. It often comes down to laboratory testing to determine whether conjunctivitis is caused by a virus, a bacterium, or an allergy. /r/n/r/n Bacterial conjunctivitis can cause a red eye that may or may not have a mucus discharge. Bacterial conjunctivitis can resolve without treatment, or it may be treated with antibiotic eye drops. It usually takes 2 to 5 days to clear up on its own but may take 2 weeks or more to disappear completely. /r/n/r/n Antibiotic eye drops may be recommended if you have pink eye with /r/n/r/n Antibiotic eye drops must be prescribed by a healthcare provider and will not work for just any pink eye infection. They treat only pink eye caused by bacteria. Antibiotic treatment may involve eye drops or an ointment. /r/n/r/n Types of antibiotic eye drops. Your primary care provider or eye doctor, ophthalmologist or optometrist, may prescribe include /r/n/r/n Viral conjunctivitis can produce symptoms of the common cold and cause the whites of the eyes to become red. It can also cause a watery discharge that may last up to a couple of weeks. /r/n/r/n This form of pink eye is usually mild and goes away within about a week or 2 without treatment. However, sometimes it may take longer to clear up. /r/n/r/n Antiviral medication may be used to treat more serious forms of pink eye. Serious forms can include pink eye caused by the herpes simplex virus or varicellazoster virus. /r/n/r/n Antibiotic eye drops won't help cure viral pink eye because they are not effective against viruses. /r/n/r/n Allergic conjunctivitis is due to an allergen. Allergens are substances that produce an allergic reaction and can include pollen, mold spores, and animal dander. /r/n/r/n The key to treating allergic pink eye is to remove the allergen from the environment. Aside from allergy medications, certain eye drops can provide relief. These include topical antihistamine, vasoconstrictors, decongestants, and some prescription eye drops. /r/n/r/n A healthcare provider can also help treat pink eye due to an allergy and may suggest a combination of treatments. /r/n/r/n Since viral and bacterial pink eye is the kind of infection that the body can often clear on its own, you may find relief from at-home remedies. /r/n/r/n Some steps you can take to lessen symptoms include /r/n/r/n To use a warm compress, take a clean washcloth, run it under warm water, and wring it out. Place this on your closed eyelids until it cools down. This can soothe eyes and help loosen any dried mucus that may make your eyelids stick together. Repeat as often as you need but with a clean washcloth each time. /r/n/r/n While infectious pink eye generally resolves itself over the course of a couple of weeks, it still is important to get the condition checked by a healthcare provider or an eye doctor at times. Even if you're sure this is just pink eye, call a healthcare provider if /r/n/r/n. Unfortunately, viral and bacterial conjunctivitis are extremely contagious. If one family member has pink eye, the rest of the household can easily get it. To keep this from happening, here are some tips. /r/n/r/n Anyone can get a pink eye infection. The conjunctival membrane can appear red and inflamed as blood vessels swell. Also, mucus can collect in the eye. It isn't always necessary to treat pink eye since the body can often heal such infections on its own. /r/n/r/n More serious cases of bacterial conjunctivitis can be treated with antibiotic drops and ointments. In addition, there are home remedies that can help with any type of pink eye, including artificial tears and warm compresses. /r/n/r/n Bacterial and viral pink eye is very contagious. To stop the spread, wash your hands often and avoid sharing any towels and linens with family members if even one person has pink eye. Talk to a healthcare provider if you have pink eye symptoms for more than a week or are experiencing other vision problems. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.